You clock your solid 8 hours, but the moment you open your eyes, you feel entirely drained. That heavy exhaustion just refuses to lift. Then comes the strange physical sensation. A prickling pins and needles feeling shoots through your hands and feet like tiny electric shocks. If you follow a strictly vegetarian diet, these physical quirks are your body's early alarms, signaling a widening nutritional void. You are likely running out of vitamin B12. Because this depletion happens quietly over time, a minor dietary gap slowly evolves into a severe threat to your entire nervous system. Dismissing these early signals gives this silent deficiency exactly the time it needs to escalate into a life-threatening crisis for your brain. This scale shows the vegetarian biological disconnect. Meat is heavy with glowing B12, while plants are empty. As reserves drain, this triggers slow-onset symptoms: brain fog, pale skin from anemia, and gasping for air on a simple walk. Medical professionals draw a hard line at the 14-day mark. If you experience these symptoms consistently for 2 weeks, you need to take clinical action. You need to request a vitamin B12 serum test. This specific blood panel measures the exact concentration of the vitamin currently floating in your bloodstream. Committing to this routine blood test at least once a year is the single definitive way a vegetarian can intercept this invisible drain before it begins inflicting structural damage on the body. If caught early, you can start at Tier 1, dietary defense. Consume dairy like milk and paneer at least twice a day, and fortified cereals and soy milks. If the lab results show a mild deficiency, doctors escalate you to Tier 2. This standard medical response involves taking daily or weekly oral supplement pills to steadily rebuild your body's vital internal reserves. Sometimes the digestive tract fails completely. Your stomach stops producing the specific proteins required to pull B12 out of your food and pills, rendering oral treatments completely useless. This Tier 3 schematic shows the logic. Left, oral pills dissolve uselessly from failed absorption. Right, a direct injection bypasses the stomach, entering your veins. This instantly rescues plummeting B12 levels to the exact concentration your brain demands. Whether you need an extra bowl of yogurt or a clinical injection is a strict biological calculation, dictated entirely by how severely the deficiency has compromised your system. Ignoring those early warning signs and skipping the diagnostic tests leaves your body vulnerable to a series of severe, long-term breakdowns. Your nerves rely on a protective coating that B12 builds. Without it, the nerves physically degrade. What begins as a faint numbness in your fingers can steadily progress into permanent nerve damage, stripping away your physical mobility and eventually resulting in paralysis. Excessive intake can trigger side effects like dizziness or skin rashes, and without blood tests to calibrate the dose, you may take more than your kidneys can effectively process. If you are already stumbling, fighting deep numbness, or experiencing sudden depression, consult a general physician or a neurologist immediately. Committing to a vegetarian lifestyle is a healthy choice. It simply requires you to actively respect and carefully manage the strict biological science behind human digestion every single day. Send this information to your vegetarian friends and family so they know exactly what warning signs to watch out for, and subscribe to the channel for more evidence-based health insights. Managing these biological blind spots ensures that your commitment to a plant-based diet remains a foundation for long-term health rather than a hidden risk.